Welcome everybody who's participating today. Thank you. I'm excited to be with you and to tell you more about all of the exciting things that are happening as we work towards fall planning. I wanted to introduce a few people to start now, and then there will be additional introductions throughout the program today. We're staying on a tight timeline, so this will be an hour and 15 minutes, and I hope you can join us for the entire thing, but of course feel free to drop off as your schedule requires. So my co-host for the introductory part of this presentation is Marion Crane, Dedrick Carter, Rob Wild, and Julie Flory. Thank you, co-hosts. And please chime in if I'm not getting something right or you think that there's something I really need to add. Hopefully we'll have a little bit of time for Q&A at the beginning of this, at the end of this introduction. And I'd love your input there as well. So before I start, I want to thank all of you who are listening for all that you're doing. Your efforts set against the backdrop of the reductions in our teams and the difficult messaging regarding the university's financial situation is humbling. This is in addition to the burden that I know we are all carrying in our personal and home lives, brought about the stress in our lives right now. And I know I speak for everybody on this panel and everybody who's working so hard on this initiative that we are so grateful for what you're doing. So thank you. Thank you for participating. Thank you for your feedback, and thank you for all that you're doing. So as we continue to prepare for the fall semester, the fall planning committee, which you're going to be hear more about from our group today, is working through many details to determine how we will proceed with welcoming our students, our faculty, and you, our staff, back to campus safely and thoughtfully. While there is still a lot of questions to be answered, we know that life is going to look a lot different when we're back in fall, and that's okay. Today you're going to have a lot of questions, and I hope we can answer some of them, but I want to tell you now in full transparency, there are a lot of things we're not going to be able to answer, and I hope you'll have patience with us and walk this out with us. So the goal of the town hall today is to share with you where we are in the planning process and to continue to hear your feedback about what's important to you, what has you worried, and what you'd like to see our campus look and feel like in the fall. I know a number of you have submitted questions in advance, and thank you, that was super helpful. You can also submit questions during this broadcast using the question and answer function that you'll see at the bottom of your screen. Lisa Siddons on the call is going to be helping us to moderate those questions and feeding those to the panelists. So thank you for your feedback there as well. I want you to know that we won't be able to answer all of the questions today, but we'll be theming the questions and providing responses to the extent that we know them on a website that I'm just about ready to show you. So please keep the feedback coming. We're right at the time period where your feedback is so important. And so please continue to provide it to us. One question that I did want to address just up front, because I know it's on a lot of people's minds, and frankly, it's on my mind too. And that's something that we've heard from a lot of our staff, and that is telecommuting. What's going on with telecommuting? Is this going to be an option in the future? So in the middle of a pandemic, I found that there are a lot of things that we've learned, and they have not all, frankly, been positive. But one of the positive things that we've learned is that we are really good at telecommuting. Many of you are so efficient and so thoughtful in your work from home, and you've used Zoom and other technologies to stay connected, and you're just really doing a wonderful job. And I want you to know that right now, as we speak, LaGail Chandler is looking at our telecommuting policy to revise it, because operationally and in the interest of things that you need and that you've expressed to us, and frankly for the reduction of density on our campus, telecommuting is going to be an important part of what our campus looks like, at least for the short term. So yes, we are listening and we hear you, and we know that telecommuting is important to you for lots of different reasons that are really personal to each individual person. So look forward to hearing more about in the short term. Finally, I want to share just some important foundational aspects that we've been thinking about as a leadership team, and we're trying to promote and perpetuate as we move through each day and each day of this process. And the first thing is that we're all in this together, right? We're going to get through this complicated, this wild and complicated walk together. Secondly, the safety of our community is built upon our shared accountability and responsibility. We take steps not just to protect ourselves, but to protect those around us. Third, we're a community made up of individuals with many, many experiences and mindsets and personal circumstances that impact the way that we see the world. We're different, and that's important. It needs to be held up and thoughtfully managed. There are also uncertainties right now that we just can't eliminate all risks. And so we need to understand that and be thoughtful about our own actions as we navigate risk assessment. And finally, the decisions on how we can best handle these uncertainties and the other operational aspects of our return to campus will be found shared with the community in his blog and in other communications that he's shared. And that is, our values are based upon 5 things. First of all, the safety, security, and well-being of our people. Secondly, our mission, that is the education, the research, and our patient care. Third is our call to enhance the lives on campus, not just on campus, but in St. Louis, especially, and around the world. It's an appreciation of our values of diversity, equity, inclusion as we consider how the crisis affects individuals of varying backgrounds. And finally, the call that we have for accountability and transparency, even when the message is difficult to hear. So one thing before I move forward, I wanted to let you know that this meeting is being recorded and will be posted on the WashU Together website that I'm about to walk you through, so that others in our community who may not have been able to participate today can go back and listen to it. Again, please continue to reach out with your comments and your questions and use the question and answer feature during this webcast as we continue to move through this. Okay, so I'm not only Vice Chancellor and Chief of Staff in Chancellor Martin's office, but I also have the honor of being the Communications and Engagement Co-Chair of the Fall Planning Committee. And one of my important responsibilities right now is to begin to walk you through and spend a few minutes sort of setting the scene for you on what's been going on with their planning process. And then I'm going to turn it over to the working group so that they can dig a little deeper and give you some more details about what they think the fall might look like. So this is the main landing page where we'll be sharing information with you. And I've shared this in the chat feature. So hopefully you can maybe scroll around with me as we're talking through this. This will be your landing spot for finding information. On the front page will be our latest communications. These communications will also be found in the Danforth Digest, and there's actually a link to the Danforth Digest and to all the previous Danforth Digests down here. Today, I want to specifically walk through the fall planning portion, and so I'm going to bounce over here to fall planning. And I'm going to start with a timeline, even though it starts with the subcommittees. So this is the timeline. It's pretty basic here, and I want to fill in some details and do some level setting with you regarding the timeline. So you may remember that in April, Andrew announced that he had established a fall planning committee. This was a communication that was shared from Andrew's email and also can be found in the record, and I can share that link with you in case you didn't see that after I'm done with my portion. But the Fall Planning Committee was charged with focusing on the educational mission of the university and to explore a number of scenarios to inform planning in critical areas, including academic calendars, curriculum, residential life, and resource management. The committee's first priority was to set a timeline for when decisions will be made and how those decisions will be communicated to the university community. And so the first thing that you heard from the FPC was a milestone decision to push the academic calendar back a few weeks with a start date of September 14th for the undergraduates. This also resulted in some other adjustments to the academic calendars that were shared earlier this summer. In May, an executive committee was appointed by Chancellor Martin to organize planning efforts for education in the upcoming year. The executive committee is charged with developing the structure for the committees and the working groups, which I'm about to explain, and drafting those charges and recruiting members to serve on those committees. Beginning in June, and a little bit actually before that, these working committees began to do their deep work, and they continue to do their deep work, and you're an important part of that work today as we pause for an intentional opportunity to get your feedback. In July, the working committees will submit their final recommendations to the executive committee, who will then synthesize those recommendations for a full report to Andrew that will be received by Andrew on July 16th. We've committed to the community and to the student community to provide details on what the fall is going to look like no later than July 31st. Okay, now I'm going to bounce over to the actual structure. So I mentioned the executive committee, and the executive committee again is tasked with organizing the planning efforts for the upcoming academic year. The executive committee communicates on multiple times a day, meeting multiple times a week, and helping to synthesize all the works of the standards committees and the working groups that I'm about to describe to you. Again, in the end, their deliverable will be a synthesized report to the chancellor that will have the recommendations for what fall will look like. The standards committees, and actually if you're at home bouncing around on this, you can click and see the committee members. I'm not going to walk through all of this because it's probably easier for you to do that at home, and view the full charges of all of these committees. Okay, so next is standards committees. The standards committees are sort of the overarching committees that are designated to inform the work of the working committees by setting the standards and laying out the foundational principles. These principles include the critical dimensions of safety, facilities, programming, and communications. And you're going to be hearing from the working groups, and we'll learn more about how their committee conversations are informed by the work of the standards committees. So when I think about I think about the standards committees in the form of like building a house, right? So the standards committees are providing the blueprints to the working committees, and the working committees are gathering the supplies to build the house. The house is what we're going to look like in the fall. The three standards committees are public health, campus design, and communications. And again, you can drop down and see the full charge and membership of each of those committees here. I want to stop and just mention now you have the ability to click on the committee chair if you have specific feedback that relates to one of the committees that we're talking about today, or the work of one of those committees. And so this is your direct line of communication with the chair of that committee. So public health, the Public Health Standards Committee is charged with developing the public health principles based upon things like the CDC guidelines, recommendations from our infectious disease experts, and other public health professionals. This committee is made up of many medical and public health professionals and is chaired by Rob Weil. The next is the Campus Redesign Committee that has a really long name, Campus Redesign, Density, Facilities, Cleaning, and Building Use. And this committee is charged with giving recommendations on all of the important aspects of how we move about campus. This includes the traffic patterns, the density in buildings, and things like how we disinfect and housekeep in all of our spaces. And this standards committee is co-chaired by Deans Nancy Stout and Mark Taylor. Finally, there's a communications and engagement standards committee, and that's chaired by myself and Julie Flory. And we are charged with providing recommendations on the delivery of transparent communications to the university community regarding learning, research, and work in support of the mission this fall. Our communications are hopefully going to be clear, timely, and foundational on the principles of public health and inspire purpose and belonging among all the members of our community. One of the important aspects of the standards of the Communications and Engagement Standards Committee is this aspect of looking at how we can make sure that when we welcome people back to our community in the fall, that we're doing it in a way that feels positive and that it really lends itself to creating an environment that is the kind of place where you want to come every day and it really feels like home. Under all of the standards committees, we then have our working groups, and you're going to hear in detail from them in a moment here. But those working groups are monitoring and containment, student housing and dining, Danforth campus events, programming, public spaces, and educational mission. Each of these working groups will be presenting their charge and their subcommittee structures, and we'll be talking a little bit about some of the constraints that they're already seeing that have been identified that will inform decision making for the fall. So that completes our introduction portion of this meeting, which wasn't even looking at the clock, and I'm smack right on time. I used my allotted 15 minutes. And so I am ready to toss it over to Dr. LeBlanc and Richard Payton to lead the discussion and presentation on monitoring and containment.
Great. Hello, everyone. I'm Dr. Cherie LeBlanc. I'm the Executive Director of Habit Health and Wellness Center, the Student Health Center here on the Danforth campus. And Richard Payton and I are co-chairing this particular working group called Monitoring and Containment. The charge for our working group is to develop recommendations for 4 key components of operations during the upcoming academic year. Regular screening, which is part of the monitoring efforts for disease activity. Diagnostic testing and managing positive cases, which is part of our containment strategy. And we've also been asked to make recommendations regarding compliance with these efforts, as well as adherence to public health guidelines like masking, physical distancing, hand hygiene, and so on. I feel that we've actually made good progress to date, and we have excellent people around the table to help guide us. We need to resolve 1 or 2 key decisions, and we need to finish mapping out the implementation of our plan. And before I discuss our recommendations, I think it's I'd like to take a minute just to review some terminology because it can be quite confusing at times. So when we talk about monitoring or surveillance, and those terms are used often interchangeably, this really refers to reviewing the overall disease activity in a community. It involves our screening and containment strategies, as well as the local and community resources to respond to cases. And these are all measures that help inform decisions regarding what level of risk the university should be operating under. We use the term screen or screening when we're looking for indications of COVID activity. A screening test is one way to screen for activity, but not the only one. A diagnostic test is used to test someone who's displaying symptoms, is suspected to have COVID, or has come in close contact with someone who is a positive COVID patient. So first I'm going to talk about screening, and what I will say is this has been a very hotly debated topic on every campus, in every listserv that I've been in, because it's not easy. It's not we don't have a great, straightforward, reliable screening test that's going to give us all the answers that we're seeking. So as I talk about screening, there's really 2 methods to screen. There's an objective methods and there are subjective methods. And the first recommendation from our committee is going to be that all employees and students who will be on campus will be required to complete a daily self-screen. Now, this is an example of a subjective screening tool. And for those staff that have been essential or are part of the phase 1, you're familiar with this tool. We're just going to have everyone signing into this tool once the fall semester begins. So we'll continue to use what we're doing now, looking for symptoms of COVID, recording our temperature, verifying that we've had no exposure to COVID in the last 14 days. If we fail this screening, employees are directed to occupational health and their supervisor is emailed. If a student fails this screening, they're going to be directed to Habit for Danforth students and student health services on the medical campus if they're a medical student. We anticipate that the email, automatic email, will go to student affairs for undergraduates or the dean's office for graduates if they have a failed self-screen. There'll also be a centralized unit that's collecting and analyzing these self-screen results, and that group will look at trends. They'll aggregate the data and send reports both on the local level to the individual schools as well as to senior administration. And what we really are envisioning is a central team that's responsible for overseeing our screening and containment strategies to monitor disease activity both on campus and in the region in collaboration with our public health departments. And this team would then advise senior leadership on the levels of operating the university. So if we look at objective screening tools now, we can consider using a test to screen for disease. And we currently have 2 main types of tests. One is a viral test, and that's the one that puts the swab up your nose, looking for evidence of the virus. This is called a PCR test. The other test is an antibody test, which looks for antibodies in our bloodstream that our body makes in response to the virus. And we hope that this blood test will be useful in the future, but it's really too early to know how it may be helpful in our current strategy. So at this time, we're really only considering the viral test. What we have concluded is that there is insufficient evidence to support a significant benefit to mass testing for screening purposes. Currently, there are no recommendations from either the CDC or the American College Health Association, ACHA, for mass screening. In fact, in a position paper on earlier this month, ACHA said, screening thousands of people will likely produce no substantial public health benefit and at a very high cost. So we really need to be careful not to overwhelm the system testing thousands of people at once, which could trigger resource issues throughout the community that could impact testing and public health follow-up of those who are really at high risk and are really a suspected case. And also, what's really important to remember about this particular test, it's only representative of a moment in time. So the moment that that swab is up your nose, if it is negative, you have not been, you're not infected. But it doesn't mean that 2 hours later, you wouldn't become infected, or the next day, or the next week. So it really just gives us that snippet in time, and that's where I think a lot of the debate is on how helpful it is to be used as a screen. It also can really create what's called a sense of false reassurance, and people might not think, well, I just tested negative, I don't need to do any precautions, and that's really not the message that we want to send out. So while we're not recommending all faculty, staff, and students returning to campus to have a screening test, we are continuing to explore whether we will recommend an initial baseline test for just our residential students. This population is most concerning given their living arrangements, the nature of the undergraduate experience, and the fact that we'd be responsible for providing both isolation and quarantine housing. So we haven't, that's still one that we have not completely set a yes or no on at this moment. So we're also looking at our random objective screening measures, and there's two really. The first is a thermal scanning, and that's been actually, if it hasn't started, it's about to start, I believe, on the medical campus. And this is introducing a walkthrough. People are randomly tested, their temperature is taken, and through some, nothing that I understand, but some Bluetooth technology that identifies that person is notified that they have a fever and they need to report to occupational health. So we're thinking about, could we utilize something like that at various points in the Danforth campus to then randomly screen people to see if they're having a temperature. The other objective option is, again, random screening, doing a screening test, the same test we're using to diagnose the disease, but do we just pick random samplings of our residential students every couple of weeks or every month to see if we are picking up what are called asymptomatic cases. So a recommendation on objective screening measures randomly, that we still haven't hit an answer to. And I'm going to now turn the rest of the presentation over to Richard Payton, my co-chair, to talk about our diagnostic testing, how we manage a positive case, and a little bit about compliance. Richard?
Thank you, Dr. LeBlanc. So my name is Richard Payton. I'm the Chief of Staff in the Office of the Chief Administrative Officer for the university, and I've been co-chairing this Group 1 monitoring and containment with Dr. LeBlanc. As she mentioned, there are 4 main pieces to our charge, and she covered the first, which was screening. As you can see, there's a lot that we need to decide, and we still have some decisions that are pending. I'm going to talk about diagnostic testing, case management, and then compliance and enforcement. On the diagnostic testing and case management front, we've been doing a lot of this work already. So since mid-March, we've been managing a few cases here and there where someone is showing symptoms and we route them for diagnostic testing. So right now the plan is to continue to follow those protocols. If an employee fails the self-screen that Dr. LeBlanc mentioned, they'll be referred to occupational health for evaluation and testing if necessary. If a student fails that self-screen, they'll be referred to HABIF or Student Health Services, depending on their campus, or similar evaluation and potentially being tested. We think that we have the infrastructure and the capacity to handle testing, diagnostic testing for employees. The School of Medicine has a pretty robust diagnostic testing operation. They're partnering with BJC, and as you can imagine, they have thousands of employees that they're covering with that capacity. So we think adding Danforth employees to that system, they'll have the capacity. We are a little bit concerned about the capacity that we have right now to manage test students. So we are exploring the possibility of adding testing capacity to cover students. Likely that would be on the Danforth campus. And we think that we'd either rely on BJC or the WashU physicians practice to staff it, but we haven't quite made that decision yet. On managing positive cases, again, we've been doing this since mid-March. So we'll continue to follow those protocols with some tweaks, primarily about resources, given that we'll have more students and more employees back on campus. So occupational health will continue to do follow-up with employees, and they are adding capacity so that they can cover the Danforth campus. HABIF and Student Health Services will continue to do follow-up with students, and they will continue their partnership with the St. Louis City and the St. Louis County Departments of Health to manage contact tracing. We do expect that we might need to add some capacity from within the university to help with contact tracing. So we're continuing those conversations with the Departments of Health to determine, first, how much capacity we need there, and then two, how we should staff that, because we need to make sure we've got enough people to do that. We are considering some digital contact tracing technology. That's a fancy way of saying using a piece of software to understand who people have contacted, if somebody is identified as being at risk, what type of risk they have, and that sort of thing. And then, of course, the other big thing that we're focused on in terms of managing positive cases is what to do with students, primarily residential students, when they test positive or otherwise need to be quarantined. And we've got some practices in place for housing and dining that Rob Wild, Dedrick Carter, and many others have put in place. So we just need to understand the capacity there. I'll just talk briefly about compliance and enforcement. We recognize that we're really going to be successful here if this is a community norm and people take this seriously and see it as an issue of responsibility and accountability, and that we're all in this together, and that it starts from the top and we can all contribute to creating a healthy environment. So our goal is to set some community norms and positively reinforce them with a lot of great communication that's clear, consistent, and frequent. Right now, if employees and graduate students on the Danforth campus have concerns about what they're seeing, whether it's someone not wearing a mask or someone not maintaining social distance, they should report that to their manager, their department head, or their dean. Now, what we're doing is exploring whether or not we need to centralize that in any way, or just how consistent those reporting processes need to be. We realize that at the local level is the best place to resolve a lot of those concerns, but we do need to understand what's happening at the university level as well. Just real briefly, some of the challenges that our group has faced, I think one is just something called the Goldilocks principle. So some people are going to think we're doing too little, some people are going to think we're doing too much, and hopefully more people are going to think we're doing just the right amount. So the goal is to provide education and continuous improvement to make sure we get as many people into that category of thinking we're doing just the right amount. There's also a lot of precedent that's set by other institutions around the country. And every time another institution announces their plans for large amounts of testing or the number of students that they're going to have in their residence halls, it just sets a precedent that people might expect the university to follow. And then finally, again, getting back to my point about compliance and enforcement, we really want to encourage positive behavior. So how is it that we can encourage everybody to continue to wear a mask, socially distance, and take those other proactive public health measures when we know it's not going to be easy because it's going to be so different than the way we're used to living and working normally? So that thing that Dr. LeBlanc and I wanted to cover, I think we are right at time. So with that, I will turn it over to Marion Crane and Jen Smith. We're going to talk about the academic component of fall planning.
Okay, I'm Marion Crane. I'm the interim provost and also professor of law when I'm not serving in the provost's office. So the educational mission group actually consists of 4 subcommittees. Jen Smith, who's the dean of the College of Arts and Sciences, and I are co-chairing the whole shebang. The goal of the educational mission group, as you can see here, is really threefold. First, we're trying to ensure that all students have a choice whether to achieve their WashU goals and their WashU education online, or to the degree we're able to bring them here in person. Second, we want to make sure that the schools are able to pivot quickly and optimally to online in a better way than we managed to do in the spring in order to respond to potential waves, new public health guidelines, or new waves of the COVID virus. And finally, we're trying to ensure that there are unique academic opportunities, that there's some sort of silver lining to this pivot to online education. And we have a group that's actually focused specifically on that. So on the right-hand side here, you can see the committee charges that are more specific, designed to help the committee through the process of producing a deliverable that is going to guide the chancellor ultimately in his decision-making process on that.
So we are, for faculty support and training, really looking to make sure that our all of our instructors have access to the support they need, the technology they need to be able to really engage with our students and achieve our educational objectives, our learning objectives, regardless of whether our students are participating remotely, participating in person, or some combination thereof. And as we're very clearly demonstrating, there is a challenge in remote engagement, and it sometimes gets even harder. No, it usually gets even harder when you're trying to work across both in-person and remote people engaging at the same time. And so the faculty support and training group is looking at different models of support, everything from self-paced modules where faculty can learn, instructors can learn about different technologies, to longer course design, kind of 2-week participatory workshops, models on different types of interaction or different pieces of technology. And so the faculty support and training group is working on that piece.
Let me give you a little bit of detail on what we're trying to do with faculty training and support. We have a subgroup that is chaired by Eric Fournier, who's the Associate Director of the Center for Teaching and Learning, and his co-chair is Nina Kim, who's the Director of the Center for Digital Education at Olin. We're really fortunate that we are not starting from scratch here. In addition to our Center for Teaching and Learning, we also have, as I mentioned, the Center for Digital Education that's been way in the forefront on working to get faculty optimized to produce online education. And then we have another group called the IT Teaching and Learning Domain, now called PLUS Committee. And that's a large group, some of you I'm sure are with us today, that are very skilled with technology and online delivery and are an incredible asset to us as we plan going forward. That subcommittee, Eric and Nina are running, has come up with a general plan for faculty training that includes at least 3 parts. One is access to already existing resources, including hour-long Zoom training and Canvas training protocols. They are developing a new opportunity called Foundations in Digital Pedagogy that will be online for WashU faculty and will be a very minimal investment of time, 2 or 3 hours, some of which can be done asynchronously, and then some of which will be done in person, question and answer, mediated by an instructional design expert at WashU. And then the third option is likely going to be a 2 or 3 week long WashU taught course that helps faculty actually prepare one of their current courses for online delivery. So it has a practical aspect as well as kind of the theoretical aspect. Through the Teaching and Learning Center, in addition, we will be developing support communities for faculty, and these will continue throughout the semester or the academic year as applicable, to be able to help people learn from what their peers are doing and make the experience a little bit less isolating. The second group that sort of works together with faculty training and support pretty closely is a group that's looking at what technology we need in our classrooms and for students to be able to effectively access this online education. Now, we are hoping and planning for a world in which we are not 100% online in terms of our instructional capability. We're trying to work towards a hybrid approach, which would allow us to have some percentage, perhaps as many as half, of our classes meeting in person on campus. Now, one way that might happen in a large course like, say, math, is we might have the lecture portion of that be asynchronous and online, and an in-person recitation. A similar pattern could be followed for large courses in chemistry or biology, with the labs being the part that is in person. For smaller classes, think about humanities classes and social science classes, some others that might be smaller. There would be a couple of options. One option would be, if the class is small enough, it could meet entirely in a classroom with social distancing that was much larger than the classroom that it used to meet in. And Jen will have more to say about that and classroom capacities as a constraint on our planning. In addition, though, we might also choose to rotate students through classrooms. So if a course met Monday, Wednesday, and Friday, 1/3 of the kids might be there on Monday, 1/3 on Wednesday, 1/3 on Friday, with the others participating remotely. In that event, we will need a lot of technology and a lot of skill for our faculty to be able to coordinate the online portion and the in-person portion simultaneously. As you can imagine, it's difficult to manage both the online piece and the in-person piece while teaching new material and taking questions from students and dealing with what other unanticipated Zoom fails might arise. So we want to try to prepare people for that, both by giving them the best technology and also by training them. So that's what that group is working on. And that group is chaired by Michael Weissession, who directs the Center for Teaching and Learning, and co-chaired by Chris Gelt, who is our Chief Information Officer and expert on all matters IT. So I'll stop there and let Jen talk a little bit about the other pieces of this, which have to do with the how do we make it actually happen. Thanks, Jen.
Okay. Thanks, Marion. I'll be brief. I don't want us to be the first group who does not come in right on time. So there are two other subcommittees associated with educational mission, and that is one called Innovation. And that's the group that is dreaming big about the opportunities we have to take advantage of incredibly unique times to connect our faculty, students, alumni, staff with opportunities to learn around what is going on. So they're dreaming big and coming up with some great ideas. The other group is kind of the opposite. It is the pragmatic, in the weeds. We're called academic operations. I should have said Kit Wellman of the philosophy department is chairing the innovation group, and I'm chairing the academic operations group, which is trying to figure out how we make this all work, particularly things around classroom scheduling. As is not surprising, we cannot fit anywhere near as many students into our classrooms when we're observing all of the public health guidelines that we would need to. When we rearrange classrooms to work in that way, we end up having something like 15 to 30% capacity that we otherwise would have. And so we're really looking at how do we adjust, or do we need to adjust, add section times, add class times, change passing times. How are we also going to implement the public health guidelines within the context of the classroom? And we are also looking for how we'll support students to get from place to place And one big piece of that is actually thinking about building density, because of course in our rooms with classrooms, there are also often offices where all the rest of us are working, and we don't want to try and pack, even if we can keep people within their rooms, their classrooms, socially distanced, we don't want to overfill buildings and end up with too much kind of congestion within those buildings themselves. And so that impacts the classroom availability that we have. So last but not least, we're also thinking about students who are participating in online classes and in-person classes, and they may need to get to a place where they can actually Zoom in and be a part of a particular class, and they'll need a place to do that. If they can't get home in the time between classes, we'll need to make sure that there are, again, safe, socially distanced places that they can go on campus to be able to participate in those online classes. So we're thinking about all of those sorts of things. Some of our smaller classrooms are likely to not get used because their capacities would be so strongly reduced by the social distancing guidelines that we don't have that many two-person classes. So there would be more spaces available. So we're thinking about ways we can use those spaces. And then, last but not least, we're thinking a bit about our academic policies and things like deadlines that students are subject to add or drop classes, things like that, and making sure that we're having policies that are flexible enough to support the highly flexible environment that we are likely to be in the fall. So that's it for our group.
Jim, before we move on, I just want to hit a couple of questions that are coming into the Q&A.
Sure.
One of them relates to your area, and that is, can you mention something about students studying online as an option if they're at high risk for COVID?
Absolutely. So if students need to participate remotely, either because they are having issues getting back to the States, if they're international, if they're high risk immunocompromised, we are building, one of the complexities here is that we are building in a remote option to nearly all of our classes. There are a couple of labs that will be tough to do remotely, but the vast, vast majority of our classes will permit people to engage fully remotely. As Marion mentioned, some of our classes are already going to be offered online, the larger classes that we now don't have a place to fit everybody, so students can participate easily in those, and then they'll be able to remotely participate in the in-person classes using the technology that our other subcommittees are making sure is in all of our classes. But yes, it will be an option for students to study fully remotely.
And just a couple other density questions. Someone has asked, are there plans to hold outdoor classes when weather permits, or using spaces in Summers Rec Center or for additional space? Also related, given classroom density issues, has there been any thought to holding classes off campus, outside around campus?
So everything's still on the table in terms of where we might put classes that we can't currently fit. There's certainly been talk about outdoor areas, and so it's currently all on the table. Right now, our next step is to see, okay, how many of our classes do we need to, are we able to offer in person? Can they fit in what we have? What are our additional needs? And then we go from there. But non-traditional classroom spaces, outdoor spaces, everything is on the table.
Okay, great. Turning it over to Heather and Jamie.
Okay, Jamie is going to queue up some slides. Thank you everyone for coming. So our piece of this puzzle is to think about Danforth campus events, programming, and the associated public spaces. And we have a very large working group, thank goodness. Many of you are on it to do that. Our charge really focuses on campus events for both visitors and students. And that includes student activities and programming, and again, the spaces. Our our hope and our intention is to help students to stay as involved as possible in the campus community, to connect as much as possible in this new format with peers, and also to have opportunities to be physically active. So thinking about how we can sort of redesign events and spaces so that that can happen. So there are four sort of prongs to this. The first is student-facing events like, you know, orientation, varsity athletics, the recreation center, which also has intramural sports for students, other kinds of student co-curricular activities, visitor-facing, public-facing events and activities, which includes a range of kinds of visitors. So that could be families coming to look at Washington University as a future school, university advancement events, which tend to attract a different kind of audience, of course, public lecture series, access to the library, etc. And then we have many spaces on campus that are either dedicated to those kinds of more public events or are certainly used for those events and services. So we're looking at this also kind of from a space perspective. And just a few examples of that on the screen, like the rec center, the library, certainly, the Duck, and many, many other spaces where students and visitors come together or where students do activities formally or informally. And then lastly, there are some compliance issues with leagues and other government, et cetera. So we're looking at how compliance will work at large. This is a quick snapshot of we believe, the current set of people that are on this working group. And we are working as a group to think about each of these individual things and kind of collectively, what are some of the management standards that we can emerge with that can help us as we navigate a kind of a calendar situation. We don't know exactly where COVID will go and the numbers will change. So we're trying to set up a system that allows us to align to wherever those numbers take us and allows us to have a system for event management and providing access. So thank you to all of you who may be sitting in this call who are on this list or connected with one of these functions. And then Jamie is going. My co-chair is going to take over.
Yeah, hi, I'm Jamie Kolker. I'm the University Architect and Associate Vice Chancellor. And as we've heard from that long list of participants who have been a part of our conversations and sort of gathering as much information about the broad range of activities and events, sort of a catch-all for things other than academic or housing or dining. So all of the other events that together make up the way of life for our students and our communities. There's a broad range of different event types. There's clearly the events where you're sitting in an audience watching a performance. There are places where you have the public interfacing with a service provider. It could be the campus store, card access, other places where you're coming together, the Kemper Museum. So it's a really broad range of types of spaces. As Heather mentioned, admissions visits clearly is a important coming together of visitors and our own community. Places where students and their resources come together is again an individualized point of connection. So how do we think about that really as an event, even though it's maybe only 2 or 3 people as part of that event? And then we have both the formal and the informal, the planned and the unplanned coming together, where groups of people come together, not in a classroom or not eating a meal or not in a housing situation, but all of those incidental, bumping into one another, getting together with friends. How are we thinking about the guidelines for those kinds of activities, and how are we providing signage, providing appropriately distanced seating where necessary, and just thinking about what the guidelines are in the framework to support people coming together in a safe way. And then clearly physical activity and well-being. I mean, we can't give up our holistic well-being because of all of the other public health precautions that are underway. How do we keep active? How do we keep physically fit? You'll be hearing about how do we eat a good meal? How do we keep good nutrition as part of our life? And all of these places that accommodate these activities are subject to the public health guidelines. You've all heard about, I'm sure you're following the social distancing and different norms, and we've been really digging into what the physical implications of applying social distancing are to our different space types. And it's complicated because a fixed seating environment inside is very different from maintaining social distancing while walking outside. So that's sort of the continuum. And in housing, it's a social distance has a very different calculus and geometric analysis that helps determine and guide what social distancing, how it can be applied to all of the activities and events that we're thinking about. Signage is going to be really important. Delineating entrances and exits, as Jen and others were talking about, being careful about flow and density in some of our buildings. We have some narrow spaces on campus that may be subject to too many people coming together based on the flow of people. So we're analyzing that. Clearly, all of the guidelines of hygiene, of masks and hand washing apply to everything we're talking about today. How does time factor into minimizing the amount of people that need to be accommodated at one time? So even though it's not a physical constraint, it's using time to spread out the density to help use our facilities as efficiently and in as safe a way as possible. And some of the strategies being considered, and these are everything's on the table, as people have been saying, but clearly some physical modifications, whether it's the plexiglass screens or other kinds of physical changes to spaces to make them safer and socially distanced be able to occur. Encouraging the use of the exterior, whether it's for formal or informal, whether it's for classes, events, or informal getting together, or just getting some fresh air in the good weather. How clearly looking at the broad range of activities, how many of those can and should happen online to free up space for the core activities of teaching and learning and research, and frankly, just to be realistic about what may we need to postpone or cancel or think differently about as we go through the fall.
Jamie, this is Dedrick. There have been a couple of questions on this outside space and use of alternate spaces, and you made a really great comment once about the original plan of the Danforth campus and the outdoor classrooms. Would you just speak to that?
I mean, we have a lot going for us in our campus plan, which I always harken back to. That's 120 years old. But if you think just in its purest form of Brookings Quad is by definition what the original architects of this campus called an outdoor room. It is constrained. It has 4 walls, but think about the ceiling is gone and the sky is the ceiling. So all of the talk about airflow and exposure to daylight and being able to maintain distance from one another, but really enjoy that fresh air and be supported in more airflow in the fresh air. We have a very, very open campus with a lot of outdoor spaces that are easily occupiable. And I think Brookings Quad and the whole East End project really took that very seriously and made a very broad range of different types and scales of outdoor spaces. So we have a lot going for us in terms of our outdoor space that we're going to think a lot about. So with that, should we turn it over to Dedrick and Rob? Or?
Jamie, there were a couple questions that I just wanted to bring up while I've got you here. Yeah. Let's see. Are other university buildings outside Danforth where we have many staff members going to have seating and workspaces adjusted to meet new density recommendations? Many of our support staff across campus sit very close to each other.
Absolutely. I would say there's a lot of work that we're beginning thinking about office space and what social distancing means in office space. And I'm always careful to let's not just think about Danforth. We have to think about North Campus, West Campus, and other spaces where people are sitting and doing work. And, you know, the trend for the past years has been open offices. It's efficient, it's collaborative, it builds community. And now what do we do now that is a bit of a challenge for us? And what are the physical changes we can make to that space, or the spacing out of people within our existing seating to make for the healthiest work environments we can?
So this is another really important question, not so much related to what you've been talking Jamie, but I want to make sure we hit it. And that is, will we be wearing masks and gloves be required as you walk across campus? Does anybody want to take that one? Cherie?
I'm just trying to find my unmute button. Gloves, no. Masks, there's a little bit of a debate. Absolutely, in any enclosed space, people are going to be wearing masks. If people cannot keep 6 feet distance between themselves outside, masks will be expected to be worn. And we're tossing this back and forth, whether it's just easier to say to everyone, you come on campus, you wear a mask, done. Or whether there is this option for people far enough away, just kind of walking back and forth to give people a break from their masks. So gloves are no, masks probably. I don't know which way we're going to end up on that. But definitely if you're just walking by, I don't think any of the infectious disease folks are worried that someone just passing another person is going to infect them. It's all about that close contact for at least 15 minutes.
Okay, Teresa, quick questions here. What have been St. Louis statistics so far on notifying past contacts? Are we able to notify within 24 hours or end of day? Thanks.
That's a very good question. I would have to go back to the County Department of Health and ask them that specific question. I do know both city and county have rapidly increased the number of people that they have working and their contact tracers, and so I do believe that they are improving on that. And it's a great question because, and one of the reasons we're considering having our own contact tracers trained, because we really have this little window of opportunity from the time someone is exposed or infected with COVID before they start to become infectious to others. And so the sooner we can find them and quarantine them, the more likely we will be to shut down an outbreak. So it's a great question. I don't know their exact numbers. I do know that they're working very hard, and our main job is to try and see how can we help them so that in our own community we can find them just as quickly as we can. Our goal will be within 24 hours.
I'm going to be really brief in case there's any last questions at the end. So thank you. And I do want to say a special thank you to Marion Crane, who has really led this executive committee and planning effort very well for the last 2 months. In terms of the housing group, we decided early on to even though we're calling it housing and dining, Dedrick and I decided it was good to meet once and then split into 2 different groups, just because there's a fair amount of work to be done on the housing and dining side. On the housing side, and it makes me nervous because there's a lot of people on this call who are directly involved in this planning. Hi, Cheryl Mauricio. I do want to explain that we divided that work on the housing side into 2 groups. One on kind of a housing subcommittee for facilities, kind of an inventory group trying to look at what are our options around density and de-densifying the residence halls. And one on that I like the title of called the Behavioral Modification Working Group, which is overlaps a lot with some of the public health items that Dr. LeBlanc was talking about. The housing situation for every university presents some significant challenges because residence halls by design are intended to put large groups of people together in common space to share that space. So I don't want to make this sound like this is an easy task for us, but it's one that we're taking on with a lot of good ideas and strategy to try to make the likelihood that COVID-19 would spread within the residence halls lower. So we're looking at some different density options right now. I don't have anything that I'm able to share on this call. We really are going to count on, as Dr. LeBlanc talked about, our students to recognize that we are all in this together. Some of us were talking with a group of students earlier this week, and they asked, well, what will determine if the university closes down at any point again in the fall and moves to alternate operations? And we said to them in that meeting, well, you do. how we can, work together to wear masks when we're in enclosed spaces, to wash our hands, to not go to class or go out if we're having symptoms. All of the behaviors that we're all engaging in are going to be very important, as is going to be the isolation housing that Dr. LeBlanc talked about, that Dedrick is actually, he and his team have done an outstanding job of working on. We don't have the final plan yet, but in order to open effectively the residence halls, we're going to need a way for students who become symptomatic with COVID-19 to move them to a place where they can continue their instruction remotely and not cause other students to become infected. And so that's going to be a key part of our planning. And then, as has been said in other parts of this call, more cleaning, making sure that our staff in residential life, our very talented housekeeping team, have the PPE they need to feel comfortable doing the very important work that they do for us, that our staff and faculty who live in the residence halls have the information they need to do their work and serve our students. And so more to come on this. It's been a very good planning effort, really led on the housing side by Kawana Leggett, who is our new interim Associate Vice Chancellor and Dean of Students, and Cheryl Mauricio, our Associate Dean and Interim Executive Director of Residential Life. So Dedrick, I'll let you go ahead and hop in on the dining side.
I will try to be brief as well. What I will say is, I agree, it's been a pleasure working with Rob on this issue. We've had a little bit of a head start because dining continued to operate through March. We had students on campus. There were some essential personnel on campus, and then moving into phase one. So our goal was to say, let's look at the things that we have shifted from normal operations. Let's understand what is working and what are the principles that we've learned from St. Louis County Department of Public Health, the public health principles, the CDC, the state of Missouri, the Missouri Restaurant Association, and the St. Louis Restaurant Association guidelines. Let's look at all of those things and develop a set of guidelines for the Danforth campus. And by Danforth, I mean Danforth Northwest. And this is for everyone. This is for faculty, staff, students, and others. We went on from the first phase to say, what are the sort of three or four things that this committee really needs to focus on? And the focus was, first, let's understand what the physical changes and requirements are at the Danforth, the North, the West campus venues that would be necessary to keep employees and customers safe. The second was, let's look at what we've learned from the operations through the period of March, looking at phase one operations to say what, if anything, what processes need to be changed and procedures need to be changed to be able to scale up to a much larger set of people on campus. We're probably at 1,100 or so people now, and we've been operating consistently since March. And then it was to say, let's think about the meal times that we have on campus, and let's understand what are the factors that impact the demand curve. So we know that historically, people arrive to campus at 15 minutes before the hour, and there's this big rush in, and then classes get out, and then there's a rush to the line. We don't want rushes. We don't want lines. So how do we manage the flow so that we don't have those things occurring? And one of the things we've done to be able to address that is, first, after developing a set of guidelines for Danforth draft guidelines, which include things that I'll talk about in just a moment, we went through all of the standard eating places on the campus and the other large areas that we might prioritize during the dining hours, which are sort of 7 to 9:30 for breakfast, 11 to 2 for lunch, and 5 to 8 for dinner. And we asked the question, what will we need to do to make sure that these were safe, effective places for bringing people in, and what was the capacity? And we looked at spacing of 6 feet and staggering of a contactless kiosk to understand what the capacity is in all the spaces. There were probably somewhere in the neighborhood of 40 to 45% just in the group of places that we have now. And so then we started to wonder what happens if you open up to more outside spaces, other things like utilizing the double box that we got, which is sort of a pop-up for dining, and maybe even activating some spaces that we have historically not used that might suit themselves for dining. We looked at additional technologies that are helping us to understand where other schools are going and what we might adopt here to continue to be a high quality program. So the dining program at WashU has been in the top 5 for the last 15 years. It's currently number 3 in the country. And so many people call us to ask the question, what are you doing to model across the country? And what we've tried to do is make sure that we hold up to that standard of really good quality food at hopefully a reasonable cost to the community. So the dining preparations that we've done is we've sort of moved to, looking at different cleaning, looking at PPEs on the way in, and monitoring people while they're in the dining facilities. We have sort of one way in and one way out on most of these facilities. And additions of grab and go. We will be using China when we open up the spaces, but only if we can do that around highly sanitized FDA regulations for washing, rinsing, and sanitizing. There will be options for disposable for those that want them. We've taken away self-serve options, and that's actually been something that we've been ahead of the curve on. Most places have gone to buffet styles, and we have not. So the retail program we have serves us well to be able to deliver food easily. And then when we opened up Parkside, we moved to a more robust mobile order pickup system. And that order pickup system we will be expanding to ensure that people can order and not have to wait long periods of time for their food. We will be marking off areas for waiting to ensure that there's a really nice distancing there. But the goal is to be as cashless as possible and as contactless as possible in delivering a serving. I'm going to stop there and say, overall, we feel very good about where we are. I think the concern is making sure that we are ready for whatever density number that we get. We're not there yet in terms of understanding where that will be, but we've sort of tried to figure out how do you scale at 0 to X, X to Y, and Y to Z, so that whatever the number is, we'll be ready for it. And I'll end there and take any questions that might come up.
So I've got a couple questions in the feed, and one is super exciting that I want to answer because it's an easy one, and that is there going to be training on taking on and off a mask? And I am excited to say that Drs. LeBlanc and Lawrence recorded a video that I can't find a link to right now, or I'd share it with Amber. So if Julie, maybe you could shoot me that link, I'll share that with you, Amber. A few other out here, and not so much related to maybe what you've been sharing, Dedrick, but here's one that's been coming up a lot. Will there be travel restrictions regarding students over Thanksgiving break? Rob, do you want to take that one?
Yeah, so I can take that one. We've been getting that question a lot about Thanksgiving break. And what I've been saying is we don't know yet on June 17th. It is very likely, if the models go the direction that they're going, that we are going to ask our students not to travel over Thanksgiving break in order for us to not have to move to alternate operations. It's also possible, based on how the situation is nationally and internationally, that we might tell students from certain areas to stay on campus rather than travel. But we are going to do our best to closely monitor the travel situation for Thanksgiving and make decisions in the fall and announce those as we can.
If I could add something to that, Rob has been a great partner for many years. I chaired the International Travel Oversight Committee, and as a part of that, we built and put in place a relationship with International SOS. International is in the word, but there's great information about what's happening both across the country in addition to outside of our borders. So when we make these decisions, we can make them really informed by a set of professionals saying, here's the health situation on the ground or the political situation on the ground in any sort of circumstance. And that's a great tool that we have at our disposal.
Rob, here's another one for you, and it's one that this comes up in conversation every day, and I bet you can guess what it is. How will social distancing and mask wearing be enforced?
Yeah, that's a great question. In fact, and I know Cheryl Mauricio is on this, Cheryl has been meeting to come up with a set of recommendations about this. We don't today have a policy that says you have to wear masks. And so we're actually working on some student policies as well as some policies that would apply to everybody on campus about mask wearing. And Rebecca, or actually Dr. LeBlanc, talked about that earlier. To be honest with you, we are going to have a good enforcement strategy, but the best chance of success that we are going to have here is a public health approach where everybody realizes that for us to be doing an in-person educational experience, every single person in our community has to take responsibility for their health and the health of others. And to do that, we have to wear masks when we're in enclosed spaces. We are working with Matt Kreuter and the Brown School, the Public Health Communications Group, to work right now on a public health campaign that we will be launching likely at the end of July and early August, to talk about the practices that we need every community member to engage in order for us to be successful this fall. So it's a great question. That we likely will have some disciplinary situations with students, particularly around their behaviors, and we're anticipating that and preparing for that. But our real chance for success is going to be around the shared expectation of each other's behavior.
Thanks, Rob. Marion, this one is for you. Faculty, students, and staff. Faculty, students, and staff have been hardest hit by COVID, particularly death and bereavement. Has planning emerged to support these individuals?
So I'm not sure what is meant by support these individuals. That sounds almost like an HR related question, Rebecca.
Okay, you may be right there. I may have read it wrong. Does anybody want to take that one?
Rebecca, if you don't mind, I can just comment. I'm Ligel Chandler from Human Resources. And I just want to remind everyone that we do have an employee assistance program. They have a number of counselors who address all sorts of challenges and phases of life, one of those most especially being when death occurs. And so I would urge anyone who needs to reach out to EAP to go to our website. They're right on the first page of it as you go there. If you have any problems whatsoever trying to reach someone in EAP and want to talk to a counselor on site, we do have individuals with social work backgrounds who can help you. And I would be happy to take your call and make sure that you're connected. We also try and make sure that people are supported in the benefits arena as well. Oftentimes there are special family situations and it's a hard time for everyone, and our benefits team is very focused on trying to make sure that we support everybody during that time and answer questions. So I hope that helps.
Thanks, Ligel. There are so many more questions in the chat and in the Q&A feature, and I'm so appreciative. I know I speak for all the panelists for all your participation today and for all of the good and thoughtful questions that you're sending our way. I wish we could have answered more of them, but I am working with Tony right now to download all the questions. We'll theme them and we'll get answers to you on the website. Some of these are more specific to kind of personal scenarios, and I hope that I can connect you with somebody on the team that can, give you a more detailed answer in some of these cases. But thank you to everyone. Thank you to our panelists and to all the work that you're doing. And thank you again to everybody that's listening. I'm thinking of all of you, and I hope that you're staying safe and healthy. And again, I'm so grateful for everything that you do each day. Have a good day.